Hi, I'm Ann Farmer. I'm the Division of Disease Surveillance Director, and that supervises 5 programs in Maine CDC, including the immunization program.
I am Jessica Shiminsky. I'm the epidemiologist with the Maine Immunization Program, and I run the school survey for analyzing the data and reporting it out.
So I think the question's been posed is how many does this bill impact?
Sure.
We'll be referencing the copy that we provided with you. I hope you all have it with you. They
Just like
the
this?
Yes. It's a chart on it. The chart.
So if you look at the first page, the chart on the bottom will give you a column for both children with philosophical exemptions, and then the next one would be the religious exemptions. So this law would affect both of those numbers. Kindergartners that were surveyed in Maine represented about 97% of the children that are enrolled in Maine schools were reported on in this survey. The numbers did go down for 7th grade and 12th grade, so there were not as many students represented in those numbers. And for the kindergarten vaccines, all of the vaccines were surveyed. So Tdap, MMR, polio, and varicella are all requirements for kindergarten students. When we looked at survey for 7th grade and 12th grade, we only surveyed the new vaccines that have been required within the last 2 years. So Tdap was mandated for 7th grade entry 2 years ago, and then meningococcal was a requirement for 7th grade and then 12th grade as of this school year. So the exemptions that you see for them don't represent all of the required vaccines for the 7th and 12th grade. So where the kindergarten vaccines are probably close to what you're seeing for who would be exempt, you can't project those numbers to all grades. So unfortunately, I can't answer how many students as a whole beyond kindergarten would be affected by this.
Carson, drink water.
Thank you.
Senator Carson. Thank you.
Thank you, Senator Carson. I don't know if you've seen this one here. If not, I'd like to give it to you.
You don't have it, yeah.
I know it's hard to analyze it, but I would like to give it to you for your review and just get your thoughts on that if we could.
So what source is this data? What source is this data? From us? It's part of it.
Yes, the source is right down below
There,
with its
thanks.
address.
I just didn't see that. We'll just review it for a second if you don't, if that's okay.
Thank you.
Yes. So does this, would you like some more time to be able to think about this?
I can review it further.
So I have to say, they didn't prepare this,
Yes.
right? This is not their spreadsheet. And I'm looking, you know, I like spreadsheets. I find that to be a happy world. But I don't necessarily fully understand whether we're talking percentages, whether we're talking numbers. They don't know this. Right? This is not their document. So I think it's probably unreasonable to expect that they're going to be able to explain somebody else's work.
I think what I'm looking at is percentages, but like I said, it's very hard to project what a kindergarten class will be looking at for exemptions in subsequent years. They may have a change of health. They may have a change of thought, the parents. So it's really hard to project those exemptions that they may not carry all the way through till 12th grade.
If you would like us, we could follow up with more information if that's what the committee decides. But
Representative Fecto.
Thank you, Madam Chair. Thank you for being here this morning. It's very helpful. So I just want to make sure I understand. If this bill goes through with your data that you have right here, if no behavior changes through a mandate, are you saying that potentially 1,988 kids would be expelled from school?
correct. That's what we're stating with the questions, that they would be turned away. There would be 1,988 in kindergarten, 7th grade and 12th grade if philosophical and religious exemptions continued, and possibly 1,977 who have missing records. That's the information that we have, but you are correct that things could change. That's based on what we have as of today.
Thank you.
Representative Sampson.
Thank you, Madam Chair. Thank you for being here. So I've got a couple connected questions. If that's okay, Madam Chair?
See how it goes.
So I kind of want to drill down a little bit on this 5% we keep hearing about, or some people are saying 6% now. Depends on the data you're looking at. Can you definitively explain to me what the percentage is that are completely and totally unvaccinated?
No, I can't.
Okay.
So, would you like me to?
Yep.
Okay, so this survey is separated. The beginning, first question of the survey will ask how many students are in a kindergarten class. Second line will say how many of those students have an exemption on file. And it will ask for how many have religious, how many medical, and how many philosophical exemptions. Further down in the survey, we look at individual vaccines that are required. So where a student may have a exemption for one vaccine, they're counted is one in the overall exemption column, but they may only have one exemption, say, to MMR, and they may have gotten the rest of the vaccines. So there is no way to account for any children that are completely, totally exempt from all vaccines.
Okay. Yeah, I will follow up.
Representative Sampson.
So I guess to give an overview, and I'd like you to comment on this. Individuals who have gotten most of their vaccinations and might have chosen to opt out of one.
Mm-hmm.
For example, chickenpox,
Yep.
don't want to do that.
Mm-hmm.
I'm talking about this questionable 6%, okay?
Yep.
Those who have a delayed schedule.
Mm-hmm.
Those who have a more irregular, they've got pockets of vaccinations that they have gotten and some they haven't, so it's sort of dispersed.
Mm-hmm.
And all of those individuals are considered part of your 5%.
Yes.
Correct.
But you don't even know how many have no vaccinations. So, but that's considered, they're in the 5%?
Because they have an exemption on file.
Okay. So if we don't know all this information, my question is why couldn't we focus on trying to shore up that information before we decide to do something far more onerous, like expelling students from school? Would there not be other alternatives that we could explore? And you all are the ones that are collecting the data, correct?
Right. So we do look at individual exemptions down to the required vaccine. So you can look individually to see how many children are exempt for each individual required vaccine.
And these are just children
School.
enrolled in school?
Children enrolled in school.
So there's others that you don't even really have records for necessarily, or do you?
What would that be for?
Yeah. What?
Students that are not enrolled in school?
Homeschool children? No, we don't survey homeschool
Okay.
children.
Yeah.
Thank you.
Senator Pouliot.
I have number of different things, but the first question I have is, do you collect data on post-secondary students? It's my understanding this bill would affect students enrolled in state-funded public institutions, post-secondary institutions. So what's the percentage of the adult population that's unvaccinated? Also, we have a workforce development issue in this state, and we're trying desperately to get more people to go back to school to finish their degrees. Are they going to be required to get vaccinated in order to go? And do you collect that data?
I collect data for post-secondary schools. Unfortunately, I don't have that, sir. Oh, I do have that survey with me. So I can tell you for the 2017 survey, so this was last school year, we surveyed 47,783 students. 3.8% of them had a religious or philosophical exemption on file for measles, mumps, rubella. 2.6% had a religious or philosophical exemption for tetanus or diphtheria.
Okay. So are they going to be required to do all of the same vaccinations that the K-12 students?
No, that's a
would do?
separate requirement. So they would still be only required to have the MMR or the TD on file.
But the K-12 students are required to do more?
Yes, those are two separate rules. So whereas the exemption language is very similar for both of them, they are two different sets of requirements.
So how, in your opinion, are the adults not affected by the same risks that have been presented as the K-12 students? And why would they not be required to do all the same vaccinations that the K-12 kids would?
I can't answer that because I didn't write the requirements for the law. I think it's the assumption that maybe they've had those as required already, because most states do require those vaccines as a childhood requirement.
But if we don't-
But it's
Okay,
not
I
specific.
just want to remind everybody that their resource, and our questions should be about specific data, not policy. So the policy discussion and questions are for the committee. So just please try to remain within the confines of their expertise and what their jobs encompass.
Sure. So to be clear, there's no formal data collected on the total number of the 47,783 students that would be required to get other vaccinations, other than the percentage that are currently doing an exemption.
Just the required vaccines for that law.
And the university system may be able to speak to more. They always have a choice to have additional vaccinations as well.
Okay. I mean, before I can make a final decision on this bill, I'd really need to know the number of people that are being impacted, because we're receiving a lot of different information. The DOE presented us with over 9,000 students that would be impacted, but based on estimates, their estimates, for non-medical exemptions, and estimated medical exemptions of 542 students. I mean, that's closer to 9,600 students. That's significantly more than the number that we've been presented by you.
Yes, can I clarify that point? So the point of the numbers that we've put forward were just based on our survey information. So we wanted to just reiterate that that's for kindergarten, for 7th grade, and for 12th grade. So DOE would have a more exhaustive source for information.
So is it your...
And I wouldn't want to comment from DOE. Someone from DOE could comment on those.
So based on your experience, would it be your opinion that there would actually be more than 1,988 students impacted?
Yes.
Thank you.
Representative Fecto.
Thank you, Madam Chair. Does the CDC keep track of any information on international students entering Maine
No.
to go to school?
No, we don't.
Okay, thank you.
Representative Sampson.
Thank you, Madam Chair.
Can I clarify? If a student is enrolled in Maine, if they happen to be an international student, but they are enrolled in the school, we would have them because they would be considered a Maine student.
Representative Fecto.
Thank you, Madam Chair. Do you have, then, would you have numbers on those that might do exemptions?
They would be included in the overall exemption, so we wouldn't segregate them out in the survey. They would just be included in the numbers.
Thank you.
Representative Simpson.
Thank you, Madam Chair. So I'm just going to take a little diversion into another slightly tangential topic, mental health. The data, the CDC data on mental health, the ranking. No, I'm talking statistics.
I understand that. They're on immunizations, they're not mental health. That's not within the scope of their
That wouldn't
jobs.
be in our scope of knowledge. We would have to take your questions back and get that information for you.
Okay. Can I ask my question?
Certainly.
Okay.
Just as long as we understand that it's not
I
there
get
where
it.
they're hired and
I'm
where they
picking up
work.
what you're putting down. Thank you.
Okay.
I appreciate it. So my question is about mental health. We have heard a lot on this committee about this. So I'd like to have very specific information of numbers that we currently have of K through 12 students with mental health issues that we're dealing with. And I would be very interested to see if the CDC is interested, if we're going to go down the road of expelling students, what the impact that will have on students that would be expelled, and would we be exacerbating the mental health issue?
Okay, duly noted.
Thank you.
Senator Pouliot.
So staying on the unvaccinated population with regard to post-secondary, this is something that's very concerning to me. I know Sam Warren's here from the University of Maine system. I'm wondering when we're through with CDC, if we could have her up to talk about the non-compliance, because the numbers that I got from them were closer to 8%, but I was hoping she could speak to that.
Representative Fecto, do you have any further questions for these?
I do have
Okay,
one.
Representative Fecto?
Thank you, Madam Chair. Do you know how many daycare students or healthcare workers this would impact? Thank
One
you.
second.
Yeah.
Is it this one?
No, these would be the surveys that would be on our website. Jessica's just pulling them up so we
Okay,
can
thank
review
you.
them.
I do not have the healthcare worker information, and we have not surveyed childcare facilities specifically since 2016. I do have those numbers. In 2016, there were 9,445 children assessed, and 3% had philosophical exemptions. It does have a note on here that religious and medical exemptions were admitted from the table based on a result of 0 for both exemption types through all 16 state of Maine counties.
Okay, thank you.
Representative Rudnicki?
Thank you, Madam Chair. So I guess a couple of questions here. So I've heard you say a lot medical and philosophical exemptions. When filling out the form, asking the survey or whatever, asking parents about the medical and philosophical exemptions, if they check both, how is that collected for data for you? Is that collected as two separate, one for exemption? So that, if that is correct, doesn't that inflate the data?
So any students are to be counted in one. So a medical exemption would be counted before a philosophical exemption would be counted.
Okay. May I follow up?
The school nurse and the school nurses would make that determination.
So the surveys don't go to individual parents, they go to the school nurses.
Okay, so what happens if the parents don't fill out all the paperwork for the documentation that's required? Are they considered exempt at that point as well?
They're considered missing, so they're considered non-compliant. The way that the law is written, each child has to have either an exemption or an immunization history for each required vaccine. So if a child is missing say they have an exemption on file for one, they're missing another, or they're fully immunized for all but one, if there's any part of that record missing, they're counted as being non-compliant.
Okay, so if they're counted as non-compliant, again, doesn't that really mess with the data? If you're looking at one exemption, like my kid got the chicken pox when they were 5 years old, so they don't need, in my mind, they do not need a chicken pox vaccine. But they would be considered at that point in your data as not being vaccinated?
Not specific to that, because history of varicella is that suffices the immunization requirement for varicella.
Is that on your paperwork too?
Yep.
Okay.
Yeah. Yep.
Thank you. Thank you for now.
Representative Sampson?
Thank you, Madam Chair. So I want to ask you some questions about herd immunity and speak to that
again,
if we could. Well, I have some specific questions.
If it's about the data, right, so
But
they're
this
not
would-
physicians.
I know.
Okay.
I understand. This is CDC information.
Okay.
So,
Well-
what I'm asking is that, do you have the percentage of adults, Maine adults that are vaccinated to the CDC schedule? You don't have that, okay.
No.
So I have this study in front of me, the CDC study, that says overall, the prevalence of illness attributed to vaccine preventable diseases is greater among adults than children. Can you speak to that?
Is that a Maine CDC report or a US CDC report?
Well, it's a US CDC report, but I would think it would be pertinent to this.
So I would like to be able to see the document so I could reflect on it, so that I could respond to it.
I'll have to get you the website.
Yeah, that would be where, and I don't know what disease you're referring to, so that would be another component. Herd immunity is for different diseases as well, so I would want to be able to more thoroughly answer your question, so I might just need more time on that.
Thank you.
Thank you.
Thank you.
Thank you.